So welcome back to another video. In this video we are going to talk about health technology. How can technology can be used in the field of health in various things that we are going to read. So let's continue. Health technology is defined as the World Health Organization as the application of organized knowledge and skill in the form of devices, medicine and vaccine procedure and system developed to solve the health problem and improve quality of life. This includes pharmaceuticals, devices, procedure, and organization system in the healthcare industry, as well as the computer supported information system in the United States. These are the technology involved standardized physical object as well as traditional designed social means and method to treat and care for patients. Pre-digital era. During pre-digital, patients suffered from inefficient faulty clinical system process and condition. Many medical errors happened in past due undeveloped health technology. Some example of medical error including adverse drug advent and alarm fatigue. Alarm fatigue is caused by an alarm is repeatedly triggered or activated on and one become desensitized to them. As the alarm work sometimes triggered by an important event in the past, nurses thought the alarm was not significant. Alarm fatigue is a danger because it could lead to death and die a situation. With technology development, and intelligent program of integration and psychological sense making was developed and helped reduce number of false alarm. Also, with greater investment in health technology, fewer medical error held. Outdated people recorded were replaced in many healthcare organizations by electronic health records. According to studies, these changes has brought a lot of change in healthcare. Drug administration has improved. Healthcare provider can now access medical information, provide better treatment and faster result and save more cost. Improvement to help promote and expand the adoption of health information technology. Congress was the HIT Act and is a part of American Recovery and Reinvestment Act. In the high-tech stand for Health Information Technology for Economic and Clinical Health Act. It gave the Department of Health and Human Services the authority to improve healthcare quality and efficiency through promotion of health IT. The act provided financial incentive or penalties to organizations to motivate healthcare providers to improve healthcare. The purpose of it was improve quality, safety, and efficiency, and ultimately to reduce health disparities. One of the main part of the High-Tech Act was setting the meaningful use requirement which require EHR, all our electronic exchange of health information and submit clinical information. The purpose of High-Tech is ensure sharing of electronic information with parent and other. High-Tech also aim to help healthcare provider have some more efficient operation and reduce medical error. The program consists of three phases. Phase 1 aim to improve healthcare quality, safety and efficiency. Phase 2 expanded phase 1 and focused on clinic processes and ensuring the meaningful use of EHRs. Lastly, phase 3 focused on using certified electronic health record technology to improve health outcome. In 2014, the implementation of electronic records in US hospital rose to high performance of 70%. At the beginning of 2018, healthcare providers who participate in medical promoting interoperability program need to report on quality payment program required. The program focused on more interoperability and aim to improve patient access to health information. Privacy of health data. Phones that can track our whereabouts step more can serve as a medical device. Medical devices have much the same effect as these phones. In research article, privacy attitude among early adopter of emerging health technology by Cynthia Chewing, Matthew Bates, Kevin Patrick, or Chewin were described people willing to share personal data with scientific advantage, although they still experience uncertainty about who would have to access their data. People are naturally cautious about the giving out sensitive personal information for next level of threat. According to research article, security cloud computing waste mobile health. Mobile devices continue to increase in popularity each year. The addition of mobile devices serving as a medical devices increase the chance of attacker to gain unauthorized information. In the chip Reauthorization Act was passed. pushing toward electronic health record, information technology integration, patient empowerment, and security involving multiple different poles based on the different views and different type of technology. Like very few completely disagreed on technology being medicine. Marvin discussed the maintenance required to protect medical data and technology against cyber attack, as well as providing a proper data and backup system for information, better patient protection, affordable policy. With the increased use of IT system, privacy violation was increasing rapidly due to the easier access of the poor management. As such as concern of the privacy, as such concern of the privacy, there are loss or theft. The virtual hacking, it become more important to protect privacy, security, peace, and data because of the high negative impact on both individual and organizations. Stolen personal information can be used to open credit card to other unethical behavior. Also, individuals have spent large amount of money to rectify the issue. The exposure of sensitive health information can also cause negative impact on individual relationship, job, other personal areas. For the organization, the privacy breach can cause loss of trust, customer legal action, and monetary fines. HIPA for health insurance probability and accountability. It is a healthcare legislation to direct how patient data is used, include to major rule, which is privacy and security of data. The privacy rules protect users' right to privacy and security. According to HIPA security rule, it ensures that protected health information has the characterized. They are confidentially availability and integrity. Confidentially indicate keeping the data prevent of loss and individual who are unauthorized to access that protection. Health availability allow people who are unauthorized to access the system and network when and where. And such as neural disaster in case like that protected health information is most like. Lastly, integrity ensure not using integrated for the consequence of using health organization of HIPA also created a administrative safeguard, physical safeguard, technical safeguard to help protect the privacy of patient. Administrative safeguard typically include security management process, security personal information, access management, workforce training, management, evolution of security policies, procedures. Security management process are one of the most important administrative safeguard. It is essential to reduce the risk and vulnerability of the system. The process is are mostly standard operating procedure written out to your training module. The purpose of the educate people how to handle protected health information and proper behavior. Physical safeguard include lock and key, card sweep, possession of screen confidential envelope and shredding the paper copies. Lock and key are the common example of physical safeguard. They can still limit the physical of facilities. Lock and key are simple, but they are to prevent individual from stealing medical record. Individual must have an actual key to access the lock. Lastly, technical safeguard include access control. Excuse me. Integrity control and transmission security. The access control mechanism is a common example of technical safeguard. It allows to access unauthorized personnel. The technology include authentication, authorization. Authentication proof of identity that handle confidential information like username and password. While authorization is act of determining whether the particular user is allowed to access certain data or perform activities system on delete. Assessment. The concept of health technology assessment was first coined in 1967 by U.S. Congress in response to the increasing need of and potential consequences of health technology along with improvement in society. It was for institutionalized with the establishment of Congressional Office of Technology Assessment. STS defined as a comprehensive form of policy research that it required the participation of individuals besides scientists and healthcare practitioners such as manager, even the consumer. Several American organizations provide health technology assessment, and these include Center for Medicare and Medicaid Services. The models adopted by institutions vary, although they focus well. A study of conducted in 2007 noted that the assessment is still not the use formal economic analysis aside from development. However, assessment technology determination of product that need to be developed cost fact. These some are need to include in assessment since health technology is never purely a matter of science. Ideology, one of the mechanics being assessed either element or alternative currently which is also referred to the fourth generation education framework. There are lists to dimension in ethical STA. The first involved the incorporation of ethics and methodological standard. Employer must assess technology, while the second concerned one ethical frame research and judgments are a part of research. High technology in the future. Yeah, I want to read about this type of technology: 3D printing, artificial intelligence, application of artificial intelligence, education, robotics, assessment technologies, consumer driven healthcare software, self monitoring technology, testing. All this technology can be used. Other top 10 technology can be artificial intelligence, healthcare, health most many industries among other healthcare with this within several applications such as examining patient information or data, the ability to develop new medication, improve diagnostic. Machine learning, which is type of AI, is a huge impact on healthcare sector. Recently, the technology is helping, for example, analyze CT scan in order to treat effect of coronavirus. But there are several other use of artificial intelligence that can go beyond the pandemic treatment. For example, AI improve cancer diagnostics. It can improve the wow, but it does not provide the full picture of the organ tissue. Now, digital scan of particular reorgan that can be a mutation may impact the key component of competency. Histopathology technique. Pathology can look and consider bigger portion of the human body at once using entire slide picture of the whole sliding imaging. Integrating data and predictive analysis connected with AI, other technology, data integration, predictive analysis help extract relevant insight about patient condition. Thanks to AI devices used such as robots enable integrated data and predictive analysis. Medical staff have insight into patient medical or can generate more accurate data. Robotics collects data patients. For example, if you really replace people in the room such as vision. Nevertheless, the reality is not exactly the same. Movies all might not replace doctor, but rather than help research, diagnosis, drugs, and treatment plan. Healthcare staff will use able to use technology maintain health. How can we use technology in the mental health? Already have completed 12 minutes in this video. Let's continue. According to the World Health Organization, mental health issues are increasing worldwide. In the past 10 years, there has been 13% increase in health illness and substance use primarily due to demographic shift. In the present day, one in five people live with disability due to mental health issue. The recent impact has been mainly due to the use of social media and COVID-19 pandemic. Remote patient monitoring and virtual care. Internet are referred to the overall network of interconnected devices as well as the technology and inter-devices and inter-cloud communication. The medical industry, often referred as the medical thing, include cutting edges medical technology like wearable sensors, 5G enabled devices, remote patient monitoring, such as some of such devices can be purchased at Moksha available. IoT device or smart pets, medical care, doctor information. Digital therapeutics is mentioned about the only solution of patient who chronic illness. Wearable in healthcare, organ care technology in bioprinting, cancer immunotherapy, augmented and virtual reality healthcare. How can you use the development of augmented reality? Artificial intelligence is a CAT scan, 3D scan data to view the body's patient. One of the designer of glass that provide mixed reality experience. Wow, sustainability and decarbonization. Mm, mm, mm. It can be used in different fields. I know that. Like in neurolearning, we will create a new video on this, but it's very promising in the future. Let's see where it goes. Founder is all, as you know, the article is part of the series about Elon Musk. It can be very helpful. Let's read about we brief what it is. American neurotechnology company that developing immutable brain computer. Based on Fremont, California in 2000, found in Elon Musk and team of 7 scientists and engineers, was launched in 2006 and was publicly opened. The company has been hired several high-profile neuroscientists from why Nigeria received 150 funding from Musk, employing a staff of 90 employees. At the time, Neuralink announced that it was working with same machine like capable implementing very thin thread into the brain, demonstrate a system that read information about the level or they have anticipated starting experiment with human 2020, but the scenes move the professional to as of 20, May 20 they have been approved by human trial in United States. So it will be very promising in the future, as we can say it can implement a thread like threads in our brain itself, and very useful for that. Okay, 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 okay. Let's see where it goes. As we know, we have completed 50 minutes in this video. Let's stop this video and we'll next one.